And tonight on PM Express, as a worrying revelation about the workplace coming and the spread of COVID-19, we're asking the question, why is the workplace leading the spread? What are we not doing right? Exactly how do we protect our lives whilst earning our income? And so we're looking at managing COVID-19 at workplaces, maintaining productivity in the face of a pandemic. Let's look at some updates for today. Confirmed cases now at 67,782. Active cases now at 5,515. Recoveries, discharge, 61,843. Deaths has risen to 424. New cases, 772. And the gender distribution, now male stands at 58%, female 42%. Yesterday, I gave you a breakdown of the regional distribution. Today, we're looking at what is making the difference today, because if you add the figures today, you either get an addition or subtraction. So Greater Accra, as at yesterday, was 3,011. Today, it's risen to 3,127, difference of 116. Ashanti region, 889. Yesterday, today is 884. Some good news there, actually, because so now you have -5 for Ashanti region because 5 people have recovered from the number yesterday. Western region, 352 yesterday. Today, it's increased to 300. Okay, so it's also reduced to 339, and we are having -13 from the Western region. So, I mean, from these 3 regions, it's only Greater Accra that has increased. In Eastern region, 163 as at yesterday. Today, we have 155. -8 because 8 people have recovered. In Central region, 121, and it's still 121, so 0 addition, 0 negation. Volta region, we have 159 yesterday. Today it has increased to 183 plus 24. So we have 24 additional cases. Bono East, 20 yesterday. Today is 24. We have 4 cases more. Western region, 26 yesterday. Today, 25, 1 recovered. And that's some good news there. Now, there are more regions. Upper East had 55 yesterday. Look at Upper East. It's very interesting because 55, it's more than doubled today, 196. So we have additional 141 cases. I mean, this is worrying. In the northern region, we had 73, and northern region has been one of the regions that has recorded, I mean, lower cases, I mean, since the outbreak of COVID. And so look at the 73 yesterday, 107, 34 more cases. And this is a worrying signal. In Bono region, we had 14 yesterday. Today, we had 24. 10 more cases in the Bono region. Ahafu region, we had 10. We still have 10 in the Ahafu region, so we don't have this discharge, or we don't have recoveries, we don't have additional cases. In Oti region, we had 2 yesterday. We still have 2. And so we don't have addition or subtraction. Upper West, we had 191 yesterday. This is encouraging. This is very encouraging. 191 yesterday. Today we had 15. We have 59. Means 132 have recovered, and this is good news. In the Savannah region, we had 1 yesterday. We still have 1, and I think in all the total 16 regions, I think Savannah has the lowest case. Northeast has 3, and we still have 3 today. No addition, no subtraction. Now, confirmed cases from January 29 to 30, in 29th and 30th. 2021. The total of new cases, 772 new cases from 53 districts in 10 regions. And Greater Accra recorded the highest number. Of course, you've seen that in the graph. And 554 new cases in 20 districts, with Ayawaso West and Korle Klote constituencies recording the highest number of cases. In the Ashanti region, 97 new cases, 13 districts, with Oforikrom recording the highest. And you have a graph that is talking about the age distribution. And if you look at from age 0 to 4, and it's comparing 2020 and 2021, if you look at 0 to 4, you realize that around in 2020, around the same time, you had 0.94, which was a very low figure, representing what? The reported cases. Now, same time in 2021, you have 1.26. This is worrying. Look at, you come to 5 and 14. So now you're told that children are also contracting between 0 and 4. Now you have 1.26, 3.13% between 5 and 14 in 2020. Now we have 3.94 children within this age, 5 to 14, contracting the disease. We have between 15 and 24, we had 17.70 in 2020. In 2021, we now have 13.22%. So the number is actually dropping in 2021 within this age bracket, 15 to 24. Let's go to 25, between 25 and 44, and you realize that it used to be 56.65. Now it's 56.40. So it's actually dropping in 2021. Between 45 and 60, in 2020 it was 16.33. Now in 2021 you have 18.26. The number has increased, and this is where the worrying issue is: workplace infections. The Ghana Health Service has identified the workplace as a hotspot for the spread of the virus. Majority of the cases, the Ghana Service says, is being recorded from the workplaces. The question we're asking: how do we maintain productivity while still protecting our lives? My guests are already seated for the show. I'll introduce them after this break. My guest tonight, Dr. Miriam Mwaku-Coleman. She's public health physician and member of the Ghana Medical Association. Eugene Abraham is research and communications manager at the Ghana Employers Association. Charlotte Hansen, head of public affairs, employment and labor ministry. And Dr. Martin Ayanori is health economist and lecturer with the Department of Health Policy Planning and Management at School of Public Health, University of Health and Allied Sciences. I'm grateful that all of you joined us, ladies and gentlemen. Let me start with you, Dr. Coleman, as the Ghana Health Service identifies the workplace as a hotspot, because the workplace is where many workers spend most of their time. How dangerous or otherwise is this revelation?
Thank you very much, Aisha, and good evening to your listeners. I want to say that this is a very good information we are getting, but we also need to look at it in context. I think we need to find out whether this workplace we are reporting is informal workplace or formal workplace. The truth is that a lot of these will be formal workplaces, the formal sector, that's what I mean. And this is because these are the places where when somebody gets infected, employers tend to be concerned, and so they do contact tracing. Other workers are tested, and so we get to know their status. And yes, this is a place where people congregate a lot, spend a lot of time together. The interaction is quite intense. And so if somebody is infected, they can pass it on to the other. So is it dangerous? I wouldn't say it's a dangerous place, because you cannot say that the infection comes from that place. It's possible that the people go to all sorts of places, but they converge at this place. And where they are coming from, if it's possible to interrogate that, that would also be very helpful. But to the extent that it's a place they are spending time together and they can therefore pass on the infection if they have it from one person to the other, yes, makes it dangerous in that sense. But really, where they are coming from and where they are bringing it from, I mean, this could be just a tip of the iceberg. That what is happening in the workplace could just be a tip of the iceberg, because these people are coming from a bigger community. They are coming from churches. They are coming from homes, communities. They are coming from public transport, So this is a good revelation, but it might just be a tip of the iceberg. And we need to look at the issues, break them down and look at them well.
Let me bring in Eugene Abrahams, who is the Research and Communications Manager at the Ghana Employers Association. The first wave of COVID-19, I must say, was unpleasant for employers and employees as well. Employers, because they had to struggle to cater for their workers. For employees, some had to lose their jobs, others having their salaries slashed. Just when things began to gradually pick up, the second wave is here and even more deadly. How dire is this situation?
Yes, hello. Yes, good evening, Aisha.
Yes, I can hear you,
Okay.
Eugene.
Thank you. Good evening to your listeners and viewers as well. First, let me thank you for inviting us to participate in this important discussion. Yes, COVID-19, as we know, is hydra-headed. It is complex, and indeed, it has really impacted the employers' community severely. When the restrictions were imposed for us to contain this virus, everything was significant until a few actors at the workplace probably let their guard down. And we're having this second wave coming up. This is indeed deadly, because if we're going to go up with this surge in the COVID. Hello, can you hear me?
Yes, I can hear you.
Okay, so I was saying that if the trend is going to go up this way, what it means is that we might go back to the days of lockdown. And in the days of lockdown, the statistics we do have indicates that close to about 700,000 employees had their wages cut, and also about 440,000 lost their jobs. So if you are going to go back to these previous days of lockdown, then what is going to happen in our economy, and then even our labor market? So we are saying that, look, we need to go back to the drawing board. Where we let our guard down, we need to pick up ourselves together, implement the various protocols that we have, do the needful, and then we're able to eliminate this virus from the shores of Ghana. Because if we're really going to go the way we are going currently, where we're throwing caution to the wind. Lately, just current information we're having from the Ghana Health Service, says that we have about 42% of Ghanaians putting on nose mask. So the question we ask is, what's the 58% doing? And how are we sure that when we leave our workplaces, we do not meet these people who are just throwing caution to the wind? So I think it's something we need to work together collectively and to resolve this so that we do not get ourselves in a more dangerous situation.
And of course, one of the questions has been how we need to manage ourselves in these times. And that's why in June last year, the Employment and Labor Relations brought in, Charlotte, I need you to handle this for me, because the Employment and Labor Relations in June brought in, issued a COVID-19 guideline for workplaces. What are these guidelines?
Yes, thank you very much. Aisha, can you hear me?
Yes, very well.
Okay, thank you very much for the opportunity. Like you rightly said, last year, National Tripartite Committee, under the leadership of Honorable Ignatius Bafoewa, the Minister for Employment, came up with a 10-point communique. And they are 10 in number. And the first one is that employers should provide PPEs, okay, and related facilities for the safety and health of workers. And this actually has to be in compliance with the WHO and Ministry of Health protocols and guidelines. For example, the provision of PPEs like face shield, nose masks, Veronica buckets, hand sanitizers, liquid soap, and what have you. Then the second one is that employers should constitute safety committees to deal with all issues related to COVID-19. You know, committees, say about 2 or 3, you know, so that at least they could come out with a response plan, so that in the event where somebody begins to show symptoms of COVID-19, or probably the person has a rise in temperature, you know that these are the policy direction that an enterprise or an institution would have to go through. And then we also looked at employers should appoint focal persons to facilitate education of workers on COVID-19. And the mandate of the focal persons was to ensure that in the event where somebody shows signs of fever, has a rise in temperature, that person will actually get the person who has the rise in temperature or a suspected case to, as it were, an isolated center, or probably if you have an office where you have prepared solely for a COVID patient or a suspected case. So that is the role of the focal person. And then you have another one where one is to create an enabling environment for social distancing at the workplace, and also encourage staff to work from home. So that has been the plan. You know, staff were to work from the home. If you have gadgets like, how do you call it, a laptop, a mobile phone, you can work from home. You can also use an online or Zoom webinar for our meeting, so that staff would not necessarily have to come to the office to work. The other point is that unions should collaborate with employers to ensure that workers comply with and observe strictly WHO and Ministry of Health enhanced hygiene and safety protocols. The local unions should also educate workers on the responsibility of protecting or promoting personal safety to the spread of COVID-19. And then employers and unions should collaborate and cooperate at the enterprise level through social dialogue to deal with the impact of COVID-19 pandemic on the sustainability of their respective enterprises. Then point 9, the Labor Department and the DFI should monitor compliance with WHO and Ministry of Health COVID-19 safety protocols and guidelines in the workplace. In fact, you know that one of our mandates as a ministry is to ensure that one of our mandates as the ministry is to make sure that workers or employers comply with safety or hygiene protocols in the office. When you even read the Labor Act 2008, 3 at 651, section section 10A, it says that workers have the right to work under satisfactory, safe, and hygienic conditions. So this is one of the mandates of the ministry, and we have the Labor Department and the Department of Factories Inspectorate being the implementing partners for the inspection aspect of the ministry.
So at the time you put together this document, we only had the original strain of the virus. Now we're getting to know that there are new variants. Has the document been updated?
Yeah, I think that before then. Hello? Hello?
Yes, I can hear you loud and clear.
Come again, please.
I'm asking, I'm saying that at the time you put together this document, that was in June 2020, we only had the original variant in Ghana, which is the, if you like, the Ghana virus. Now we're getting to know there are new variants, i.e. the UK variant, the Brazil variant, the South Africa variant. Have you updated the document to suit the situation?
Yeah, not really, because, hello?
Okay, so we'll try and fix Charlotte's audio and bring her back on. But let me gauge your mood on this, Eugene. Now it has become very necessary to keep a small size, at least from what Charlotte is saying, and also from the president's last address. Employers should activate the shift system. It means that a number of employees would have to be away from office. How do you ensure that productivity is not grinded to a halt even as we keep to the protocols?
Okay, thank you, Aisha. Yes, before I even go on, before the president gave his current address, we had sent a release, okay, a circular to our members, informing them on what to do, given that we are experiencing an uptake in the virus, and especially we're having new variants in the system. So yes, this release has informed them on what to do. They are supposed to design shift schedules, for instance, and those who can work from home should do that and do it appropriately. Now, linking it to productivity, the question is, how do you optimize? How do you ensure that workers work from home and also keep the organization going? We have looked at issues of helping employers to build capacity of their staff, because working from home implies using technological devices, which would need new set of skills that previously were not in our labor market. Today, you need more of IT skills, even communication skills, and then also be able to manage employment relations. So we have informed our members on this in this trajectory, and also trying to even come up with a capacity building series. We term it Protecting the Business. Okay, it's going to be a webinar series, and we're doing that for the first quarter. We're looking at how to manage health issues at the workplace, and COVID-19 is the major topic we're going to be looking at. We're also going to look at how to even communicate effectively during crisis periods. We're also looking at how to manage employment relations. We're looking at this because this surveys we conducted indicates that we're having increasing disputes at the workplace. We need to have understanding between management and workers, because these are trying times that we all need to collaborate and work. So these are things that we're putting in place to ensure that we maintain productivity whilst we contain this virus. Like I indicated, there's a need to balance these two sides. We need to actually optimize. Like I said, we don't need to let our guard down. If we look too much into just making people work from home without actually even monitoring, being able to monitor our workers, it means that we're going to have productivity issues. And if we go on this line, how we're going to raise the revenue and even to pay salaries and our other inputs. So these are things that we want to actually adapt.
Dr. Anori, 345 million full-time equivalent jobs have been lost worldwide. I mean, in the third quarter of 2020 alone, another 53 to 53% of MSMEs worldwide have fallen into debt as a result of COVID-19. In Ghana, the story is not different. Many businesses have folded up. Many others have had to reduce their staff and slash salaries due to the COVID-19 pandemic. With the second wave glaring at us, what could be Ghana's story?
Yeah, thank you, Aisha, and a very good evening to all your viewers and listeners. I think that it is important that we all stick to the rules, and the ground rules is that we need to all reevaluate, we need to all re-strategize and reinvigorate the public health safety measures that have been outlined by government and WHO. In Ghana's case, if you look at the data that we have from the Ghana Statistical Service, based on a business tracker survey that they did on the impact of COVID, you would realize that within the first quarter of the COVID, that is between May and June, and then August and September, we were badly hit. Just like one of our colleagues said, relatively there were about 770,000 people who apparently had their wages reduced. And in terms of laid off, we had about 14,000 people who were laid off within that period of time. Fortunately, during the second survey that was done by the Ghana Statistical Service, we only had 8% of the workforce that were laid off. My best guess is that perhaps during the second wave of that survey, many of our safety protocols were disregarded. So perhaps people went back to job as normal. And then because of that, we did not realize the huge impact of COVID on business. But in the long term, I think that this second wave presents a new opportunity for us to really look and think about our public safety measures. And I like the kind of discussion in the studio where we are looking at some of the work-based measures that were initially put in place by government. The key thing that we need to look at is how have these measures worked over the period in time. And listening to my colleague from the Labor Department, one of the two things that I want us to really have at the back of our minds and then reinforce as we move into this second wave is to look at how can we ensure that compliance with these safety measures at the workplace are enforced. And then how can we also bring informal sector workers? Because all we are talking about, just like Dr. Coleman said, we may just be talking about people who work within the formal sector. What about those who are working in the informal sector? What strategies are we doing to ensure that whatever occupations or whatever jobs they are doing, their lives are still protected and they will intend to protect the lives of the majority of Ghanaians? So I think that the second wave is too early for pundits or for me to predict the impact, but I think that we may do a threshold between 5 and 10% job losses. But in terms of the impact on small to medium scale enterprises, I think it will be huge, particularly if we move from this stage into a partial or a total lockdown. The consequences will be very devastating. If you look at the survey that was done by the Ghana Statistical Service, they tried to sample firms to find out whether they were aware of even any support that would be available to perhaps give them a boost in terms of their business transactions. And just a few of them, less than 5%, were aware of most of these initiatives. So I think that our best bet here would be to still see how we can enforce strictly the work-based measures that have been put in place by government, ensure stricter compliance, as well as ensure that we rope in the informal sector workers because they are also a chunk part of our workforce, even though our discussions are really not centered on them.
Dr. Coleman, we've established the fact that these workplaces we're talking about could be the formal sector because, of course, it's those people who will report that they've tested positive. Those people will name their contacts, and those contacts will be traced and tested as well. So these are the places where we could pick records compared to the informal sector where many people will not even report that they're positive. But these are the places, the formal sector, where many say also obey the protocols more than the informal sector. So you've conducted many researches in the field of public health. What signals are you picking as reasons for the spread of the virus at workplaces, i.e. the formal sector?
All right. So within the formal sector.
Okay. So I wanted Dr. Coleman to handle this for me.
All right.
Thank you, Aisha. Yes. So some of the reasons could be that, again, maybe the office spaces have not changed. So for those who have not adjusted the way they work, so that maybe some are working at home doing the shift system, or those who can work virtually are really working virtually. It means that they are sharing the same spaces, and this confined space, and this is the places that the virus tends to thrive. Also, you realize that as people stay together, in as much as they are observing the protocols, they tend to get familiar with each other. So they might go into the office space, wash their hands at the entrance with their mask on, they get in, and as work goes on, people, may put away their mask and start talking to each other, engaging each other. People sit in meetings for a long time and they are not wearing their mask most of the time. And this could be ways in which the virus could spread. And so these are the important thing with COVID is not to take anything for granted and not to get familiar with anybody as much as possible. Observe the protocols to the letter. And it's not just one aspect and then you leave the other. So you think that because you are wearing mask, you can get yourself together in a closed space, or you are observing social distance, so you are not wearing your mask, or you think that my hands look clean and I've not touched anything, so I'm not washing my hands. When we take any of these for granted, then we could just be exposing ourselves if somebody is infected in our midst. So the key thing is to keep our eyes on the protocols all the time. That's what I'll say.
Charlotte back. If Charlotte is back, I want to engage you on the update, whether we've updated the document and what we intend going forward, especially with enforcement, monitoring and enforcement. Charlotte.
Yes, thank you very much. Aisha, I think that the protocols and guidelines that we have currently, they are standard. That is the standard everywhere. And this standard, as I talk about, is even enshrined in the Factories, Offices and Shops Act. That is 1970. So it's a standard protocol and guidelines that we're looking at. So I don't see the reason for which we need to update. But I believe that as and when there's the need for us to do some update, we'll go ahead to do that. But for now, this is what we are working with.
Let's talk about monitoring and evaluation, because that is where many are worried, because the document may be there, but how are we monitoring? Because we've had to deal with employers who do not want to really follow this protocol. We've had to deal with employees who have complained bitterly about some of the needs of the employee, which the employer is not providing. How is monitoring like? How is enforcement of these guidelines? How do you plan to do this? Or how have you even done it all this while?
Okay, thank you very much, Aisha, once again. I want to say that last year, I think around the 2nd of July, can you hear me, Aisha?
Yes, very well. Very loud and clear.
Last year, I think on the 2nd of July, the Honorable Minister Ignatius Bafwewa put in place a team where we embarked on some kind of institutional inspections. And so when we got to, in fact, it was a random kind of inspection. We had to go to the manufacturing institutions, we went to the service institutions and what have you. But we realized a lot of things. And it will interest you to know that about 90% of institutions that we visited were complying and adhering to the protocols. It was only a handful that were not. But to be honest with you, for those who were a bit recalcitrant, we had to tell them that they should do the needful and that will revert to them in a week. And as we speak, we have gone back and we have made sure that they have put in place the necessary protocols and guidelines so that workers will be safe at the workplace.
Great. So are there sanctions for flouting these rules?
Not really, Aisha, but we is sort of trying to encourage, because you and I know that COVID is very deadly. If I catch it, I will transfer it to everybody around me. So it's sort of encouraging workers and employers to strictly adhere to the protocol.
But don't also forget the fact that in adhering to these protocols, you may have to give out more, finances, because you talk about risk assessment, you talk about some provisions that on a normal day wouldn't have been provided by the employer. Some employers may think about the money they're going to be spending. So if there are no sanctions, God, people who are not wearing masks are fined how much? 12,000 cedis, and employers who are not obeying these guidelines can go scot-free?
Yeah, Aisha, I get you right, but I guess that this is the reason why now the Aisha.
I can hear you loud and clear.
I'm saying that I want to believe that is one of the reasons why the president has directed that from henceforth, if you are arrested without a nose mask, you face the consequences. If you contravene the law, you might have to face the consequences. So I believe that that one is within the jurisdiction of the police. But for the Labor Department and the DFI, that is the Department of Factories Inspectorate, we might be limited in that area.
So if you go to a workplace, for instance, on your normal monitoring, and you realize employers are not obeying these guidelines, what normally do you do?
So, like I indicated earlier on, when we enter the premise of an institution, the first thing we look at is whether or not our temperatures will be taken, our details will be taken. After which we sit with management. Then we go around to observe the kinds of signages, the kinds of publicity, the response plan that is in place, the management documents as to their commitment, whether or not it is in place. Now, after we are done with that, we come back and sit with management. Then we point out to them, ABC, these are the things that you don't have in place. Can you please rectify them within a week? So within a week, we make sure we go back to ensure that the right thing is done. And believe you me, Aisha, the Labor Department, the Department of Factories Inspectorate are on ground every day. They are on grounds to ensure that employers and workers are safe at the workplace.
When I return from this break on PM Express, we'll be looking at the decisions we take in trying to curb the spread of the virus. In doing so, normally it's science, but also not forgetting the economic implications of taking some of these decisions. We'll look at how to do this whilst not hurting the economy at the same time, right after this break. Welcome back to PM Express. We're talking about the workplace as hotspot for the spread of the COVID-19 virus. And we're looking at how to protect lives at workplace, taking into consideration that we need to work to earn incomes. How do we juxtapose the two? Eugene, specifically, what would you say are the immediate needs of employers and also to employees to be able to survive the virus, especially as experts have established the dire impacts this could have on businesses?
Okay, thank you. First, let me indicate also that, Ghana has a very large informal economy. We have informal employers who work underground. They work outside the confines of the law. And so we may need to relook at how we can resource them in terms of the PPEs. Okay? If you look at the formal work sector, like you indicated, this is the area where they abide by the rules. They have all the various tools to fight the pandemic. But if you look at informal employers or actors in the informal economy, this is where we throw caution to the wind. And at the end of the day, you can work in your formal sector or formal organization, and you come out to meet these informal players. So what do we do to ensure that they do not catch the virus, spread it among the formal sector workers? We would need to revisit some of the stimulus packages, see how we can do it more efficiently and then effectively. We also need to, at the national level, look at how we can balance our budget. Already we're projecting that the economy will grow at 1.9%, even after we reviewed it from 0.9%. We reviewed it upwards. So our government and stakeholders may need to relook at how we can look at working with the informal economy to ensure that we bring this chapter of COVID-19 to a close.
Dr. Coleman, let me bring you in here. We're talking about how businesses can survive and how we can support them. But let's not also forget that the biggest loser could be the employee because of the psychological effect of all of this on the worker.
Yes, Aisha, and I think that that's a very important point that we need to consider. The government needs to consider that, the employer needs to consider that. These workers are now faced with perhaps meeting their targets as it is in this current situation without the conditions that existed before. And so what measures are put in place to make sure that they are supported to be able to meet these targets without the pressure on them is very important. Now they are thinking about how to keep themselves safe, how to keep their families safe, and they are thinking about how to meet their job target. And it's very important that we have a system in place that thinks about that and makes resources available to them. Again, people are being affected by COVID, and that's a reality as long as they are coming from the population. What support is there for them in the workplace so that they don't feel like we got ourselves into this situation and we are on our own. So the people who get affected, we should make sure that we are supporting them through the process till they come out and they test negative. If the hospital, we've talked about the need for them to have a committee in place, a health and safety committee in place. They should also have a link to a health facility where their workers can get the sort of support they need to be sure that they are really getting themselves treated. A lot of people test positive for COVID and they are getting managed at home. It is a health facility, it's a health provider that will decide whether your situation is such that you should just isolate at home or you should go to a health facility. And all these we need to ensure that this is happening, they're having the right care so that they'll come back to work, because eventually if they are well, it benefits the employer and the workplace and the productivity. We must make sure that in the workplace, people who get COVID are not stigmatized. And this is very important. So if I get COVID in the workplace, who should be told in the workplace? We should have a system where, yes, as a matter of responsibility and because of the public health nature of this COVID, people need to be informed because your close contact may have been affected. But the communication about this should be well managed in such a way that the person feels like nobody is pointing fingers at them and they can come back to their folk and work when they are well without any problems. We need to make sure that we are managing the psychological effect of those who have lost their job, those who are now having to look for means of funding for their families so that they can be able to be productive as we expect for the nation.
Dr. Anori, in taking drastic measures to reduce the virus often, governments rely on science, but also not forgetting the economic implications of whatever decision we take. This is a difficult one, and I must say I don't envy the president at this time at all. What's the ideal thing to do in times like this?
Well, Aisha, I think that within the first wave, government did its best in terms of the stimulus package for firms and workers and employers, and even for employees in terms of the free electricity and water that we enjoy. But beyond that, I think that there is a need for government, since we are talking about employers and how they could be pushed into this period of the pandemic. There's a need for government to provide further subsidies for them, because one of the key things that these firms and businesses are actually suffering from is liquidity challenges. If you look at the data that came from the Ghana Statistical Service, most of the companies suffered what we refer to as demand, supply, financial, as well as uncertainty shocks. So these 4 levels of shocks had serious impact on the businesses and firms. So for these businesses and firms to thrive beyond the second wave that we have, then there's a need for government to improve the liquidity chances of this. How will they do this? There's a need for them to be able to provide incentives, particularly those who want to go in for loans and be able to revamp their businesses. There's also a need for government to look at new models of engaging firms, especially those who want to go into using digital technology to improve their sales and their outcomes. I think that one of the things that government can also do is to see how we can set up a mortgage kind of system that provides lending to firms to offset their rent out. Because one of the major challenges that most of these firms are facing is to how to pay their rent out whilst they are not operating, because that's a huge toll on most of these businesses. So on a scale of 0 to 10, I think that government has done fairly in the past wave. We may have to look at how we can still continue to provide the stimulus packages that have already been provided, even though that will cost government. But it is the best bet to do, to be able to ensure that small and medium-scale enterprises that still remain the backbone of Ghana's economy do not break down. Because we only have few large firms that are export-driven in terms of our country output. So there's a need for government to see what can be done within the short, medium term, particularly the fact that this wave has still not struck us hard, to see what can be done to do that. But I just want to end off by adding to what Dr. Coleman said. I think that there were very brilliant points that you raised as far as how workers can be able to work in this period of the pandemic. There's also need for employers to provide support. You already made mention of that, but there's a need for support for workers who are returning, whether they have COVID or they don't have COVID, how they can be able to integrate within the workplace and provide meaning as far as their work is concerned. And one of the key things that Dr. Coleman touched on, which is very relevant, is risk communication. How do we move forward in terms of communicating risk for among employers, the employing community, as well as the employees within the health sector? So I think that those are key things that we need to look at as we move ahead in containing the pandemic.
It's quite an interesting one. Dr. Coleman, I want to find out from you that at this stage, it's impossible for businesses to close indefinitely. Some work definitely has to go on. Productivity must be sustained. But at the same time, the safety protocols must be observed. How do you recommend that we achieve this? You've already talked about the psychological support, but at the individual level, what should the employee or the employer do at the individual level to sustain productivity and stay healthy? Dr. Coleman, kindly unmute for me.
Sorry. So we've heard what the Labor Ministry has provided in terms of guidelines for workplaces. And I think that document is pretty comprehensive. You were asking if it's been updated. With the new variants of COVID that we are seeing, I don't think that those guidelines should really change. If they are really adhered to, is still good. We're finding that they are more infectious, they spread easily. And if you're able to go by those guidelines, they are good for us. But I think the important thing is for the employee to realize that at the end of the day, we are all responsible for our lives. So as much as the employer is encouraged by these directives and guidelines to do what is right, the individual needs to take on a personal responsibility and make sure that whatever resources the employer has made available to make the workplace safe, they use them and they comply with the guidelines and make sure that they are safe for themselves and also for their families.
Eugene, finally, let me ask you, what do you want to see going forward, especially with the protocols that has been provided, the guidelines by the Labor Ministry? What do you want to see by employers, from employers?
Okay, thank you. First of all, I would like to see a more compliant society. It's not only about employers, it's all about all of us. Like I started with my initial submission, I indicated that it's a collaborative effort, okay? Because why is the workplace having rising
cases?
Where is it coming from? Is it coming from our homes or the marketplace or the playing fields? So we would need to work together collectively to eradicate this.
Thank you very much. Dr. Amwako Coleman is public health physician and member of Ghana Health Association, Ghana Medical Association. Eugene Abraham is research and communications manager, Ghana Employers Association. Charlotte Hansen, head of public affairs, employment and labor relations ministry. And Dr. Martin Ayanori is health economist. I'm grateful that, ladies and gentlemen, you were able to join us on PM Express. My name is Aisha Ibrahim. Many thanks for watching. Enjoy the rest of our programs.